Hello, cannabis scientist. Welcome, and bienvenue to the Cannabiscientia live on LinkedIn for today. And today live session promises to be a very nice exploration, an important exploration, as we are going to explore the role of cannabinoids in allergology and immunology. From the literature, we know that the cannabinoids have a well documented role, a well established role in immunology. But today we will explore their role in conditions such as atopic dermatitis and inflammatory and autoimmune disease of the skin. And in doing this, it's a great pleasure to have with us an expert in the field, that is Dr. Marcello Albanesi, a clinical allergist and fundamental immunologist from the Allergology and Immunology unit in Bari, Italy. Moreover, Marcello is the CEO of a startup called The Allergist, and he will bring to us and to you, to all our guests, a wealth of expertise and knowledge to the forefront, because he's a doctor that is applying in the real life, in the real clinical set, the cannabinoids in condition, in skin-related condition. So, without further ado, I will give you welcome, Marcello. Thank you for being with us today, and I give you the floor for this. I hope I'm sure very interesting presentation about the role of cannabinoids in allergy and immunology. Please, Marcello.
So thank you, Fabio, for this nice introduction and for having me this afternoon. So as Fabio mentioned, I'm Marcello Albanesi, and I hope that everyone sees my slides. So I think that Fabio can confirm it. And so I am Marcello Albanesi, and I'm a clinical immunologist and a fundamental allergist, and I'm the head of an allergy and immunology unit that is based in Bari and Rome in Italy, and I'm the chief executive officer of a new company that is called The Allergist. So today I'm going to share with you some of our recent findings on cannabinoids in allergy and immunology. So I think that it's important for us to know that I am an immunologist. So what are we talking about? So basically, when we think about immunity, so every one of us, I think, has learned either in medical school or during the studies that immunity is what guarantees us protection. But so, for example, if you take plants and you go all over the evolution to human beings, every one of us has a form of immunity, and everyone from plants to human has a particular form of immunity that is called innate immunity. For example, this that you can see here in this leaf is a form of hypersensitivity reaction in a plant that is made up to contain the infection in the plant. Then when it comes, for example, to humans or even rodents or fish, we have also a more elaborate form of immunity that is called adaptive immunity that enables us to make specific responses. But what I think is important to go on in this seminar today is to understand that the immune system is not something that just fights foreigners, but the immune system checks everything that we come in contact with. So, ranging from viruses to cancer cells, and even, for example, fetuses or drugs are checked by the immune system when we come in contact with them. But the immune system classifies the things on the basis of danger. So, for example, viruses are dangerous, so the immune system will respond. Bacteria are dangerous, and the immune system will respond. But drugs are not dangerous, so the immune system will not respond. And fetuses are not dangerous for women during pregnancy, so there will be tolerance. That is another kind of immune response. So, my personal interest in cannabinoid fields was born when I was an emergency physician during the COVID outbreak. And I was that night in the emergency room, and there was a man that was brought to my attention for a confusional state. And as you can see here in this graph, on the top right graph, it was positive in the urine for cannabinoids and cocaine. And so what I was thinking, aside, of course, stabilizing the patient and give clinical assistance, is that the immune system has to see actually cocaine and THC in that case. And the immune system works in this way. So the first question that the immune system responds to is, do I respond or not to these substances? And unless you have an immunodeficiency, the immune system will respond. But the second question is the more important. So what kind of response do I make? Do I tolerate, for example, cocaine or THC, or do I not tolerate? Okay. So this was an interesting study that we did, and for example, on the top in the upper panel, as you can see, where you have written neutrophils. So we analyzed the neutrophils in this patient, and it was surprising to us to find that this patient had nearly 95% of neutrophils circulating, and as you can see in the CT scan on the right, there was no sign of infection whatsoever. So I started to think that there was something that was linked to the recreational drugs, recreational substances at the time. And on the bottom panel, you see the adaptive immunity. And for those of you who are not immunologists, the adaptive immunity can be shared, is mainly made up by lymphocytes that can be actually divided in T cells and B cells that can be recognized by surface antigens that are CD19 or CD4 and CD8 for the T cells. So the CD19 will be the B cells. And as you can see, in healthy donors, normally, for those of you who are not familiar with this graph, every dot is a cell. And we see that there's a cloud of CD19 positive cells that are about, in a healthy donor, 7%. But then if we move to the right, in the patient, we have a spike in this particular cell that are CD19 that is nearly 18%. So we concluded in this work at the time, there was a case report, that the concomitant abuse of THC and cocaine might induce immunological changes. And that was important for me because basically we have defined that the immune system is actually able to respond to THC and to cocaine, and it can drive a neutrophil expansion and a B cell expansion. And in this table that you see here at the bottom are listed some of the, for example, effect on the immune system that either cocaine or THC can actually exert on the immune system. Then I don't have to explain to you that, I mean, this is the temple of cannabinoids, but the cannabinoid system is quite complex and has a wide range of effects in all our body. But what triggered my interest at the time after making this case report was that actually immune cells express some of the receptor for cannabinoids, for example, CB1 and CB2, and that this, according to the literature, can be actually linked to an immunomodulation, as they would say. So, for example, the working hypothesis would be this one. So from cannabis sativa, for example, you can have the cannabidiol, that is the CBD, and the CBD might interact on lymphocyte with its own receptor that is called the CB1 receptor. And if normally on the right side we have a physiological lymphocyte proliferation, via the interaction of cannabidiol through its receptor, we would somehow inhibit the lymphocyte proliferation that is at the basis of the immune responses. So to test this hypothesis, we made a simple experiment at the time, and this is the work of Nada Shaul. So we go from the left side to the right side in this slide, and we take the blood sample from a healthy donor, and we can actually isolate the lymphocyte. Then afterwards, this lymphocyte, we can render the cells fluorescent using a fluorescent dye that is called CFSC. And this is actually very important for cell tracking studies, and we can expose the cells to a mitogen. And if the cells are actually proliferating, we will have a loss of fluorescence over time. For example, where you have seen first division, so the two cells that you see at the bottom will have the half of the fluorescence of the mother cells, and so on. And we can actually monitor this phenomenon using the flow cytometer. That is an instrument that is really important for us immunologists. And this is the graph on the in the graph that you can see on the right side at the bottom is the cell count as a function of the fluorescent intensity, and the different peaks that you see are the different cell divisions. So we can actually monitor the cell divisions. So the question that we've asked at the time was, what if we expose the lymphocyte to the mitogen that is called phytohemagglutinin, PHA, in presence or not of cannabidiol? And in these two panels where you have seen where it's written T and B cells, you can see the proliferation. And as you can see, we have a nice proliferation in blue in the presence of the mitogen, but whenever we put on the cannabidiol, the CBD, this proliferation is somehow reduced. And we can actually quantify this phenomenon, because if we move to the panel that is on the right side, you see that there is a reduction of the lymphocyte proliferation in vitro that is induced by the cannabidiol. And we wanted to test also the effect of CBD on innate immune cells, and a good model for that is to use cell line. This cell line is called U937 cells that are promyelocytes, that is commonly used as a model for monocytes. And if we cultivate these cells in the presence of CBD, what we see, so on the in the panel on the left, you see the normal cells. These are healthy cells that are not treated with anything. But if we increase the dose of CBD, we start to see some vacuoles forming in the cytoplasm of the cells. And of course, we can quantify the damaged cells, as you can see on the right. And the more you increase the concentration of the CBD, the more we have damaged cells. So what we concluded from this study is that our immune system actually seems to respond to the CBD, but there is a different response. So for example, we have an effect on T and B cell proliferation, but we have a dose-dependent effect on monocytes. And of course, the first question that we might ask, okay, this is really basic science, so what are the clinical implications for that? And so I think that one nice clinical implication for that, I want to share some of the work that we have done with you, some of my experience, and I would really like to hear your feedback on that. So I don't know if every one of us is aware that in our body we have some immune privilege sites. So the immune privilege sites are sites in which there is no immune responses. And this is due to two different phenomena that are either immune deviation or immune ignorance. So the organs are physically uh, far away from the immune system. And this applies to the brain, eyes, spinal cord, testicles for men, and pregnant uterus for women. But there's another organ that is important. There is another case of immune privilege, that is the hair. So the hair has different stages of hair growth, from anagen, catagen, telogen, and exogen. And in its replicating phase, that is called anagen, the hair is an immune privileged site. So there's no immune responses in this site. And normally the hair would look like you would see on the left side. But whenever you have a breach of tolerance in this compartment, you might have pathology that is called alopecia areata. There is a loss of hairs, as you can see here. So our question in this case was, is there a role for cannabidiol in this particular condition, since we have seen a role on lymphocytes? So this is a clinical case of a woman that you can see on the upper left panel that had a spot of alopecia areata. So we devised a galenic preparation that was containing clobetasol at 0.025% and CBD at 2%. And as you can see here, there is the treatment outcome that is it spans for 4 weeks. I'm sorry that there's this black image here. So there's 4 weeks of treatment, 3 weeks with clobetasol, and 4 weeks with the CBD containing cream. And as you can see here in these pictures, the diameter of the lesion is progressively reducing. So we concluded from this case that it's actually a good a useful tool. For example, CBD might be a useful tool in the case of alopecia areata. Then we move to allergy. So allergy is a really a huge part of our work as allergists and immunologists, because normally atopic, if we take the meaning of these words, means uncommon. But if you think about it, and if you look at the image on the left, it's not that uncommon condition, because, for example, nearly 35% of the people in Italy are actually atopic. So this is not uncommon. And on the right side, you have some actually of the main problems that an atopic person can have, an atopic patient can have, for example, ranging from respiratory allergy, drug allergy, or even dermatitis. And we do not have to forget that allergy actually belongs to immunology. So it's a part of immunology, okay? So we will focus now on dermatitis, and in particular on our experience on dermatitis. So the atopic dermatitis is an important uh, clinical condition for us, because we have a lot of patients, and it's normally due to an influx of lymphocyte in the skin. Okay, so and this that you can see, this histology at the bottom is an histology of atopic dermatitis. There are a really wide range of treatment for that, for example, steroid, immune suppressant, antihistamine, ointments are really important, but also cleansing agents. And now we have also some monoclonal antibodies that have been developed for that. But the cleansing agents are really important for atopic dermatitis because are part of the daily routine for these patients. So at the time I was collaborating with a company that was doing a cleansing oil that was containing CBD. So we performed this study. So we treated patient with atopic dermatitis with clobetasol, and we divided the patient into different groups. So the upper group would be the patient that are treated with clobetasol and with a CBD containing cleansing oil. And the bottom group will be treated with clobetasol and with non-CBD cleansing oil. And we monitored the symptoms of this patient using an app that we have devised. Actually, here is written mobile phone, but it's not. We monitored via our website the patient symptoms, and the results were interesting for us because, for example, this is the itch scale as a function of times of the weeks, and as you can see, the CBD group has a steady decline of the itch compared to the control group. And pre-treatment to post-treatment pictures are an example. The pictures are not always nice to see in this kind of presentation, but we had also the resolution of the clinical symptoms on the skin. And recently with my company that is called The Allergist, we have designed a crème lavante, as we call it, that is containing cannabidiol, since we had this nice effect on this. Another important tool for not only for atopic dermatitis, but also for inflammatory dermatitis are the ointments that are widely used. And I want to share our experience with this, then I will close our seminar. So our experience started with this patient. I don't know if all of you are aware of the fact that sometimes allergy can be delayed allergy. For example, drug allergy can have really nasty reactions on the skin. And in particular, there's one compound that is called allopurinol that is used for the treatment of uric acid. And in some predisposed patients, and our patient was of this kind, allopurinol can actually directly interact with the T cell receptor on the T cells, and this induces an expansion of the T cells, and then you can have delayed hypersensitivity, and this is called technically the PI concept, and you have the desquamative lesions on the skin. So as for the other patients, we have prepared a galenic preparation that is containing clobetasol and CBD at 2%. This time the treatment was shorter, so the clobetasol was given for 2 weeks, while the CBD was given for 3, and we had the resolution of the clinical symptoms. And this kind of scheme, we have applied it to different other forms of dermatitis. As you can see here, this graph is not really, I can tell you, real, because I think that something happened in the transfer of the slides, but we have applied it also to drug allergy, contact dermatitis, and atopic dermatitis. And some of this information, in particular on 2 clinical cases, I've shared it in this book that was edited by Fabio Ambiola, that is called Principle of Cannabiology, in the section of dermatology. So, but basically, I really believe that the topic CBD can be used as a potential adjuvant treatment also for inflammatory dermatitis. So, to conclude this seminar, my take-home message for my part in allergy and immunology. So, our immune system do respond to CBD. So, there's an interaction between the CBD and the immune system that can actually have an effect on different types of response. So, T cell proliferation, B cell proliferation on monocyte, and this can actually have diverse clinical applications. So I've shared with you my experience in alopecia areata, in atopic dermatitis, and in inflammatory dermatitis. So with this, I've concluded, and these are my acknowledgements. So these are my working team, and a huge part of this work has been done by Nada Shaul, that happens to be my wife. So it's it's even more beautiful, this work. And the clinical assistance of the patients was given by Vincenzo Resta and Concetta De Chirico. You can find us on all the social media. And the allergist Crème Lavante is out today, and we have a patent for that. And you can have more information either by emailing me at marcello.albanesi@centroalbanesi.com or www.theallergist4.com, and I will be happy to answer your questions. Thank you.
Thank you, Marcello, for this very interesting and precise presentation. We touched very important points regarding the role of cannabinoids in immunology and allergology. I think we added some knowledge more compared to what we knew. For example, it's very interesting the role of cannabinoids in alopecia or hair loss. I knew that it was something that was investigated in the last few years. If I don't remember well, there have been a research group in Turkey that made a similar research, but I was not able to see the results clear as in this way. So, I have a question regarding this. How many patients did you treat, and in how many patients did you see comparable results or good results?
With alopecia areata, you mean?
With the alopecia, yeah.
So we have treated up to now, I think, more or less 7 patients, but we have to make a distinction. So as an allergist and immunologist, for example, I use this kind of protocol when the alopecia is really contained. So for example, you have a little spot, and then you can actually do a treatment with the atopic treatment, because when you have a global alopecia, I would not be, that sure that this protocol might work. So I think that what is important is that CBD and steroids, of course, can be an important, let's say, adjuvant tool, but the selection of the patients is important. So I think it's important not to give the message that we found the cure for everything. No, I think that
Yeah.
is important to really classify the patients and, as you can, target the patients. Okay.
Yes, thank you for having outlined this because usually people talk about medical cannabis as the panacea of every disease, but we know that it is not the truth, and especially we know that with the cannabis and cannabinoid, we need a personalized medicine. We need the medical doctor needs to know the patients, the needs of the patients, and to calibrate the therapy according to the needs. We don't have a standard protocol as we are used in other condition with other drugs, but in medical cannabis therapy, it's important to let the medical doctor visit the patients and know the patients and calibrate the therapy. And I think what you are doing, Marcello, also with your
Yeah,
treatment.
I think that for in my experience, it's important to know that you have a tool that you can use. Okay, so CBD is something more that we can use. Really, atopic dermatitis for us, you have a lot of treatments, and sometimes none of these treatments work. So if you have something more, it's nice. Okay, but we
Yeah.
really have to target the patient and select the patient and understand what are the possibilities.
Okay, I have another question. You say that you started to work with cannabis and cannabinoid not so long time ago. And in your experience, do you have noticed something, some outcome improved by your patients with the use of cannabinoids compared to the past where you didn't use this in your practice?
In atopic dermatitis, yes, I have to say that I was. So if I can share my story,
Yes, of
maybe
course.
it's useful also for other people. So at the beginning of my unit, I was really looking for funding. So I was collaborating with this company, and they proposed me this study on cannabinoids, and I was like, listen, no cannabinoids, this is never gonna work. Okay. So, but then I have atopic dermatitis. So I've tried the cleansing oil on myself, and I was like, wow, this is actually working. So I started to, to try it on the patients, and the patients were super happy. So I would rather say that really is an important tool that, and I really thank you for giving me the opportunity to share my data, because it's something more that we can bring to the patients. Then it's an interesting topic also for scientists, for us that are interested in science. But aside that, it's really important for clinic. Okay, so I have really seen a difference before and after cannabinoids.
So you can say that something changed in your clinical practice with the use of
Yes,
cannabinoids.
yes, definitely.
Okay, I have another question. I know that it's difficult, especially in Italy, but have you ever tried also THC or THC-rich cannabis extract in your clinical practice as topical application?
No, but for a particular reason, because so for example, all the galenic preparation that I've shown you, these are CBD crystals, synthetic crystals, but there's a reason behind that, because for example, for us, allergies, terpenes, and these kind of compounds are actually at the basis of some delayed hypersensitivity reaction. So I prefer not to use, for example, extraction CBD that comes from extraction, because it might contain terpenes and other things. So that is my main uh, the main thing that stops me from doing this kind of things.
Yes, of course. In this way, you can more easily understand if the effect you observe is due to the cannabidiol,
CBD or
cannabinoid,
others.
or other.
It is true. It is true that, I mean, I've seen several seminars, for example, applied to the nervous system or other things, and they talk about this entourage effect, of cannabinoids that are actually working because terpenes and all the entourage molecule that comes with it. But in my experience, cannabidiol is working super fine. So, you know, I was really happy with that.
Yes, I know. Of course, when something works, why not use it? Yeah. So we arrived at the end of this hope very interesting talk. I hope that you learned something from this topic with us. If you have questions, you can write down the page of the event. You can also write to info.cannabiscientia.com or to Marcello Albanesi directly if you want more comment. Thank you, Marcello, for being with us. See you next time, maybe with another interesting talk like this. Goodbye, everyone, and see you.